Video lecture chapter 42, Extraoral Imaging, in the Modern Dental Assisting book. Extraoral images are taken when large areas of the skull or jaw must be examined or when patients are unable to open their mouths for film placement. Types of extraoral images include panoramic, cephalometric, computed tomography or CT, temporomandibular joint projection, or cone beam. Panoramic imaging allows the dentist to view the entire dentition and related structures on a single image. It is used to locate impacted teeth, detect jaw lesions, and observe eruption patterns. Digital panoramic images can show small interproximal carious lesions. Image receptor and tube head rotate around the patient to produce an overall view of the maxilla and mandible. Advantages and disadvantages of panoramic imaging. Advantages include field size, ease of use, patient acceptance, and less radiation exposure. Disadvantages include image sharpness, focal through limitations, distortion, and cost of equipment. Types of panoramic units: film-based imaging, direct digital imaging. The main difference is image receptor. Digital units use sensory array rather than film. An image is produced immediately on the computer monitor rather than on a film after processing. Film trup, also known as image layer. When a patient's jaw are positioned within this zone, the resulting radiograph is reasonably clear and well defined. If jaws are positioned outside this zone, images on the radiograph appear blurred or indistinct. Size and shape varies. Equipment includes, with film-based panoramic X-ray unit, screen-type film, intensifying screens, and cassettes. Components of panoramic X-ray unit include the tube head positioner, exposure controls, film and intensifying screens. Common errors, patient preparation errors could include ghost images or lead apron artifact. Patient positioning errors could include the lips and tongue, chin too high or too low, posterior to focal through, anterior to focal through, or the spine not straight. Specialized extraoral imaging. Extraoral radiographs may be taken with the use of standard intraoral X-ray machine. Special head positioning and beam alignment devices can be added to the standard X-ray unit to aid patient positioning. Panoramic X-ray units may also be fitted with a special device known as a cephalostat. The cephalostat includes a film holder and head positioner that allows the operator to easily position the patient. Skull radiographic images, most often used in oral surgery and orthodontics, may be difficult to interpret. Most common types in dentistry include the lateral cephalometric projection and the posterior-anterior projection. Temporomandibular joint radiograph. Radiographs of the TMJ can be very difficult to examine because of the multiple adjacent bony structures. The articular disc and other soft tissues of the TMJ cannot be examined radiographically and can be used to show the bone and relationship of the jaw joint. CBCT. During a cone beam CT examination, the arm rotates around the patient's head in a complete 360-degree rotation. While doing this, it takes anywhere from 200 to 600 two-dimensional images that the software collects. It then digitally combines them to form a 3D image that can provide the dentist or oral surgeon with valuable information. Advantages and disadvantages of CBCT. Advantages include lower radiation dose, brief scanning time, anatomically accurate images, and the ability to save and easily transport these images. Disadvantages include patient movement may causing artifacts, size and field of view, cost of equipment and needing to learn a new computer language, and training in interpretation of image data. Additional advantages. Even digital two-dimensional images cannot provide any information about width or depth, nor can they distinguish between the types of hard and soft tissues. CBCT has greatly enhanced the diagnostic abilities of the dentist by providing vital information necessary for proper placement of implants, extraction of impacted teeth, and determining the exact location of the mandibular nerve prior to surgery. Common uses for CBCT would be in implant placement, extraction, exposure of impacted teeth, in endodontic assessments, evaluation of TMJ disorders, orthodontic evaluations, and pathological evaluations. This concludes our lecture.